Well, I first got my injury way back in 1992 when I was playing badminton. I got the pain, but after taking medication, admitted to the ward for 1 week's rest, then it was okay. Based on the X-ray, the MRI, the doctor told me that I was having a slip disc, but it was not that bad initially until I got the relapse a couple of times. Until the fourth or the fifth time, if I'm not mistaken, the fifth time, my disc was totally almost out of my vertebra. My wife is working, my daughter is working, was going to look after me. Even that when I was bedridden for a couple of months, my wife did have to continue the work.
Yeah, most of the household things that we have to do, and then some more because my daughter and I are working, so it's a hard time because we only come back in the evening. Berino cannot help because he's in pain. Really worry because it's not easy that if you can work again, that is a very difficult moment.
So I was staying alone at home. My wife prepared the food for me by my side. I can't even move to the toilet. I can't move around, I won't be able to go to the church, to the supermarket, shopping, or whatever my activity which I used to do before. I was worried I'm not going to be able to meet friends, to socialize. That was my main worry. Of course, surgery is always the last resort, according to the doctor. But during that time, I really cannot bear the pain already. Even after taking tons of painkiller, it won't help. I went for surgery in June 2008, and then I was informed by my doctor that this is going to be the first types of surgery. The risk is there, I know, but I have a strong. I know he can do it, so I just sign up. I give them the consent to do the operation.
So this is a problem of a relative young man with nerve impingement or radiculopathy, more commonly called sciatica. This is one of the many possibilities of someone with degenerative lumbar disc disease. Now this is the model of the lumbar spine, and here you could see this is the cartilage in between the vertebral bodies called the intervertebral disc. Now changes with age or injury on the cartilage can give rise to several patterns of condition. One very common one is called disc prolapse, where a piece of material from inside this disc prolapse out or squeeze out from the original place into the place where the nerve passes through. Like what you see here, this is an example. So that particular nerve, depending on where is the prolapse, will be pinched and cause pain, numbness, weakness, and if more severe, even a condition called caudal equina syndrome. Most time, this condition can be treated with medication, physiotherapy, or injection. But some patients eventually require surgical treatment to help them back to normal activities. Intervention we call quality of life intervention. So in that situation, then the first goal of the surgical treatment is to free that nerve from pressure, a process called nerve decompression. So once the nerve is free from the pressure, the pain or the sciatica goes away. Sometimes when the nerve is pinched together, you also see that there is instability or there is extreme degeneration of that disc. And in those patients, we might also perform fusion on top of neurodecompression. So this is an MRI examination of the lumbar spine. The most important test we need to make a diagnosis of intervertebral disc prolapse. Here you can see in this particular image, you can see in the L45 disc is prolapsed out posteriorly, indenting onto the dura or the theca sac. And this is usually worse on one side than the other, so the patient have one side symptoms. Holding on my left hand here is an acrylic model of the lumbar spine. You can see similar. But what this acrylic model allows you to see is the pedicle screws that is used to stabilize one motion segment. And you can see that for each motion segment, we have 4 screws construct. 1, 2, 3, 4, and then connected by 2 rods on the side. And you also notice here there's this structure look like a block where we perform interbody fusion. Now this is the most confident way we can achieve solid fusion in a segment of our spine. So this is another model showing a similar construct, but I just want to highlight in the whole spine, normally we will have the soft tissue covering like this. So to perform this procedure, we can have the traditional way where we make an incision in the middle and we peel open the muscle to allow us to do this procedure. And that has been done for many years. However, recently we are able to do the same procedure without the need to do this big operation. What we do now is we make a small incision like this, and also here 1-inch incision on both sides, and you can perform exactly the same procedure like what we used to do with a much longer operation. With this new technology, not only you can also treat the patient with the same efficacy, but it's much safer and the recovery is much faster. Typically, a procedure of 1 segment fusion, the hospital stay is 24 hours. As regards to the treatment of sciatica or radiculopathy, our experience of success rate is more than 95%, which means that majority of the patients undergoing this procedure will be satisfactory relief of their symptoms. Many people ask about the risk of the surgery. Understandable, because the nerve is very near the prolapsed disc and is where exactly the aim of the operation is to free the nerve. So to allow us to free the nerve adequately, we will have to usually visualize the nerve or even retract the nerve or manipulate the nerve to perform the decompression. This is the nerve that we are talking about. During the operation, now we can have a special nerve monitoring equipment that picks up the signal from every nerve and display it on the screen. And just by looking at the signal and the waveform, we will know whether what we are doing at that moment in time is threatening the nerve root in question. So this gives us a very confident way that the operation will not injure the nerve root. The purpose of this procedure is to create a fusion between 2 vertebral bodies. The process of fusion takes between 6 to 9 months. In the meantime, this particular motion segment is held together in a very stable manner by the instrumentation or the fixation. So to prevent untoward events of the screw loosening, we usually advise or limit the patient to reduce strenuous physical activities until X-rays show that this segment is fused completely.
Well, I went down to the operation theater, I think in morning, and then the operation completed probably around evening. Then they sent up to the recovery wards. But I think by 5:30 or 6 like that, I was conscious already. And then I was able to sit on the bed. And then by night time, I can even walk to the toilet. And then the next day, I was discharged already.
It's quite fast also that he can walk after the operation. And then the next day he can sit on the bed already. And then discharged, there's no need for the wheelchair. We just walk from the hospital to the car park.
I don't know really how to explain my feeling at that time. I was so happy at that moment until when I was discharged. I was walking down to the car park myself, so I was really like it's a new world for me. After 4 months of experiencing very unbearable pain.
Everybody is so happy that he can walk again. That we don't have to think that he is immobile. So he can go back to do his daily activities.
First thing morning, 6 o'clock, 6:30, woke up, take a bath, I drive. I've been driving all this while. My wife is not driving, so I send my wife. We went for breakfast. After that, I sent my wife to office. Then I went to my office. My parking was quite a distance from the office, so I need to walk probably about 10-15 minutes from my car park to the office. So every day I have to walk 10-15 minutes to the office, and then I see whether today how many patients is under my appointment list. 2 or 3 patients per day, or even 5 patients per day. I have got another office whereby I need to, is on the 2nd story block. I prefer to climb the staircase up to the 2nd story. It's no problem with me. Because I don't like to use lift, so I just walk to the 2nd story to my office. 3 times a week, we went for jogging with my wife. Jogging at the parks, jogging for about 1 hour, 1.5 like that. And then sometime weekend evening, if I'm free, I play badminton with my neighbor. Then well, everything was okay. There was no pain already. I'm very happy everything was back to normal. But except that I was advised try to avoid, heavy lifting, sudden bending, or whatever. That's what I'm trying to avoid. But in terms of pain, no, I don't have any pains now.
After the operation was successful, so we planned for the holiday. Where did we go? We went to Phuket. We really enjoyed the moment that he can walk again with families.
We planned for a couple of holidays, a family holiday. We went to Singapore, Thailand, KK, even up to UK. We've been to UK for a holiday. whereby I don't have to worry about any more pain. I just like to enjoy having fun with the family, holiday.